Greetings. This is Mushtaq Memon, Professor Emeritus from Washington State University. This video is dedicated to mare infertility with the ovarian abnormalities. Before we talk about abnormalities, let us appreciate again the normal ovary. So the mare ovary, as you may recall, is a kidney shape or bean shaped, which has got ovulation fossa, and the follicles always ovulate from their fossa. The size of this ovary could increase substantially during estrus time in the breeding season, depending upon how big and how many follicles are on the ovary. So when you're suspecting the ovary, which is larger than normal, so there are so many different ways to think about it. One is that you can do the obviously palpation per rectum and do the best you can and figure it out what is there. But I think ultrasonography would be your ultimate tool to try to get the answer. And even in normal ovary, as you can see on this picture here, on left-hand side, the round black area on the picture there is the mature large ovarian follicle. But this follicle, as it gets close to ovulation time, it changes shape from round to more almost like a conical. And the right-hand side at the bottom is the follicle, which has become conical. And usually these follicles are ready to ovulate in about a day to 2 days. And they're relatively soft. So the shape of the follicle tells you how close is the ovulation time. But as I mentioned here, the typical follicle size at ovulation is, around 35 to 45 millimeters. But I have seen some follicles larger than that. Once the ovulation takes place, then in some ovaries, and some ovaries of the mares, they keep on bleeding for a while. And that blood accumulates and makes this large hematoma, or ovarian hematoma. So when you're palpating this mare and trying to figure it out, why this one ovary is so large? Well, this ovary is essentially normal, but has this, blood accumulation or hematoma. And the one thing to think about is the opposite ovary is usually normal, does not have any problem of other kind. So the most common ovarian problem or tumor we have is granulosa cell tumor, or GCT. As I mentioned, it's relatively common and has a very interesting shape. Usually it's multicystic, or some people call honeycomb structure, as you can see on this picture. It increases the size of the ovary quite a bit. And for some time, the ovary becomes so large that it creates kind of colicky symptoms to the mare. So I think we need to put all these things together, your physical exam, the history, and everything else, to come up with a good diagnosis. Now, what is unique about this granulosa cell tumor? Well, the good thing is that it's a benign tumor. Other ovary is very inactive and small in size. Again, ultrasonography would also help you to try to see that multicystic structure. Now, these tumors are very active hormonally. Means they produce, quite a few hormones. The well-known are three, which have been found, like inhibin, testosterone, and progesterone. So, to getting close to the confirmation of the diagnosis of this granulosa cell tumor, you can send a blood sample to the lab. And what has been found is that almost 90% of these mares with GCT have increase in alpha inhibin. And almost about 50% of these mares with GCT have increase in testosterone. And about 1%, or I should say the other mares are having less than 1 nanogram of progesterone mean that usually these mares are in estrus. Now, depending upon which hormone is dominant, for example, if the testosterone is the primary hormone which is dominating that mare's system, as you can see on this picture, it shows the multicystic GCT, but at the same time, you can see at the bottom, enlarged clitoris. So this is a mare producing a lot of testosterone from the GCT. So you can see that how important it is when you're doing physical exam and reproductive exam to really look and see. Now, if you see a mare which is pretty, quiet and estrus, but at the same time has this kind of enlarged clitoris, which you can see, I think you could suspect something. I don't want to go into too many details because I have seen some mares with almost behave like a stallion. So there's other thing that you keep in mind that testosterone can influence the mare's behavior and personality to act like male or a stallion. Another good news about GCT is that if you can remove that one ovary, usually is done obviously surgically, then the other inactive ovary start becoming active again. But it takes about 2 to 12 months for that ovary to become cycling again. I have seen these mares who become productive in a way that they come in estrus, they get pregnant and carry full term. So this is a kind of hopeful situation if you come across with this condition. There are some less common other tumors too. So I have given you the name here and the picture of teratoma, and there are descriptive information in many sources. I wouldn't take too much of time here to explain each one of them because they are not really that common. So with that, I am going to stop and invite your questions and comments about this video and the information I have given to you. And please go ahead and ask those questions on the YouTube channel. Until then, I wish you well. Bye-bye.